This section will cover the outer part of the leg and the hips and the glutes. So this band of tissue that my husband likes to flex all the time is referred to as the IT band. So you have a very, very small muscle. I'm going to bring this down just a little bit. Right in here. This is called, we call it the coffee muscle. It's called the tensor fascia lata, or tensor fascia latae. And so this small muscle, which is here, which is opposite the ASIS, is attached to a very, very huge band that comes all the way down to the knee and can also become very, very tight and contracted and cause especially runners, it's called IT band syndrome. I want to see if you can flex that. Straighten your leg, and then can you flex that again? There we go. So this is the IT band here. So the technique again is going to be the same. Okay, relax, bend the knee. The best way to get the IT band is when the client is on their side. If you have, I will show you how to do the draping for this momentarily, but just for purposes of this video, I just wanted to show you how you'd be able to address it. When I was at Maxwell Air Force Base, I dealt with a lot of runners, and when I was working on this one lady, and I told her that this wasn't going to be any fun, and so she referred to this muscle as the I hate you muscle. So she hated me for a little bit, but then after she was done, she was fine. So I'm going to start down here, and I'm going to work my way up towards the greater trochanter. If that's too much, you just let me know. You don't have to come all the way down because we're going to be addressing the hamstrings in a little bit. Just enough to where you could just get past this IT band. I'm going to stop about here because it stops here and it does continue to go up towards the TFL. So with this hand, I'm just going to kind of follow the line of the IT band, and then with this hand, I'll follow it up all the way to the TFL. You're tapping your fingers. Is it too much?
I'm just praying.
Oh, you're just praying? Okay. Okay. You can bring your knees up just a little bit higher. There we go. Good. Sink in, sink in. You just don't want to jam your client, especially when it's guitar string tight like this one is. So now with this fist, I'm actually going to take it up and in towards the TFL. I'm going to concentrate on the hip next. So you want to always ask permission to move clothing when you're going to work on certain things. So can I move this down?
Mm-hmm.
Thank you. Okay. And then I'm going to stop because I'm going to actually bring the camera around so you can see me work from the side. All right, so the goal from this angle is that you do this, you're going to do your spread, and then you're going to work. So the greater trochanter is here, and you're essentially going to be working in and around the glute, and that covers not only the glute, but the 6 deep lateral rotators that we will cover in AP2. But just for, if we would concentrate just on one, it would be the piriformis. So with your fist, or even you can use your forearm if you want to kind of be able to carve around. I'm gonna have you bringing these up just a little bit higher. Thank you. There we go. See how that that greater trochanter kind of came out a little bit more. So you're going to be curving around, and I would take probably about 2 rows. And it's easier, once you sink in, it's easier to do it this way as opposed to having your client being face down. So my elbow just kind of lines up with that greater trochanter, and I'm just carving it around. I'm going to show you one more angle to do this from. And then I'm coming down like my elbow is almost lined up with the sacrum. And again, sinking in, body mechanics, and then curving around. Okay, and that's how you would address the glute from the sideline position. I'm going to show you real quick how to do it from the prone position as well, even though I just said it's just better to do it from the side, but I mean, you could do it any way you want, but the prone position is just a little bit more detailed. I'm going to show you that one next.